Ashley, tell us about your IT band.
I'm feeling it on the side.
Yeah.
Feels like it's rubbing against the wall.
Yeah, how bad is that? Is it, so every time you fit, so I just had you run, what would you say on a scale of 0 to 10, 10 being the worst possible pain ever, what would you say that is?
Like a 6.
Like a 6? Okay, let's go in the lab and see if we can't get that to go down. Guys, welcome back to the Recovery Lab. Sorry for the absence. We're going to do another session sit-in video for you guys today. So today I have rockstar collegiate soccer player Ashley here. Say hi, Ashley.
Hi.
So Ashley's got just is like halfway through preseason for college. She just came in today with kind of a gnarly case of IT band syndrome. Okay, so she's getting a lot of lateral knee pain, kind of like really only when she runs, right? So when she's running, she feels it, and as kind of the running and practice persists, it kind of gets worse and worse and worse and worse. So what I want to show you guys today is kind of the classic treatment from a manual perspective on how to treat a case of IT band syndrome. So the IT band is this long kind of tendon connective tissue that's kind of going from her TFL and her glute into this lateral part of the knee, okay? A lot of times the classic treatment for this is icing, lots of cryotherapy, stim, right, that kind of stuff. And a lot of times that's really not going to be all that effective, because just because this area is inflamed is just because it's being irritated by the fact that there's a dysfunction up the chain. So what we're going to see today is I'm actually going to do some TFL and glute release with Ashley. Then I'm actually going to kind of free this IT band up from the underlying connective tissue, so that lateral quad, that lateral hamstring. Then we're going to do some Graston technique right at that local insertion point just to bring some blood flow to the table. Finish up with a rock tape application, and then presto, we're going to retest her in the gym and see if that feels any better. So stick around. Hope you guys enjoy. We're going to start with Ashley. I'm really just going to work on this lateral quad. So she's, I've been laying on her back. So I'm going to just start with some basic effleurage. Just kind of working through this quad, warming up this tissue, okay? She's not really point tender right now, so it's kind of like still stage 1, kind of like tendonitis down in there. It's not really bothering her to the touch, but it's definitely, not fun while she's running, and obviously it's getting worse as she goes. So really we're just kind of working through this lateral quad. I'm going to start moving her into some more of the active techniques. So like I said before, the problem with like the traditional cryotherapy method is it's really not getting to the source of the problem, okay? It's just treating the symptom. And the treating the symptom is fine. Cryotherapy certainly have their time and place, but right now this is all inflamed because it's being irritated. So I want to reduce that source of irritation by decompressing that attachment point. So what you're gonna see me do now is kind of this active technique, and you guys have seen me do this before. So I'm working her in a knee flex position. Does that hurt? You feel that on the side of the knee? No, right? Feels okay? So I don't want to irritate those symptoms anymore, but it's interesting. She feels it when she's running, and it's most likely in that swing phase, right? So as this leg is coming forward, right before heel contact is where that IT band is probably going to snap over that lateral aspect of the epicondyle on her knee, and that starts to get really, really irritated. So the fact that I can move her into flexion unloaded here, it doesn't bother her at all, right? So the flexion phase isn't the symptomatic phase, it's really that eccentric leg swing. Tender up here, huh? Tight. So I'm gonna get a little deeper, it's pretty tender up here. Yeah. Okay, so now I'm kind of working up into this common flexor bundle and into her TFL. And this feels really dense and tight up here, okay? So this is kind of the source of that pain. And if you guys look at an anatomy map, I'll flash the anatomy map like right up here. But if you guys look at an anatomy map, that TFL is only like a couple of inches long, that small little muscle, and then it connects this long IT band. So that bad boy is pretty much like a bone, okay? You're not gonna stretch your IT band. There's no such thing as a tight IT band. They don't exist. If your IT bands are tight, you usually have some kind of hip dysfunction. So leave her in this flex position. Now we're gonna do some Graston work. And what you won't see me really do today is work on her IT band. And for the same reason I just told you guys before, you know, working on her IT band, it's super sensitive, it's super painful, and you're not really gonna change that tissue. So I don't really see a great return on that time investment to put her through like unnecessary discomfort of just rolling and raking on this IT. You're gonna rolling this IT band a lot. So you wanna focus more on rolling the front of it and right behind it. And we want to create some shear force on that, right? So we want to free that IT band up from the tissues underneath so that those sliding surfaces glide a little bit better. If you're just pressing directly on it, what you're going to do is irritate that fat pad back here. And this thing doesn't have very good blood supply, okay? So that can be part of that pain too, is that irritated fat pad. So I just put some cocoa butter on here. Use the handlebar tool, okay? This is the scary one, but it's not going to hurt. And we're just going to work on this lateral quad to start kind of creating some blood flow through this quad area. So I'm not trying to crush her, but you can tell this anterior hip is really, really tight and painful, and I can feel how gritty and crunchy that tissue is. So I'm gonna go ahead and switch instruments here and go to the convex one. Really focusing on like that TFL, that common flexor bundle as it kind of attaches on. Like this is her ASIS right here. So we're really working up into that hip. Pretty gnarly up there, huh? Not the best. Beautiful. Okay, great. Nice. So I'm going to flip her over. I'm going to show you guys how to release that glute from the other side, guys. So this is what we're going to do now. I got her in prone, okay, so she's nice and comfy. I've kind of draped her with this towel so that it's exposing her upper glute area. So what I'm going to do is I'm going to use my thumb and kind of really work on that upper glute as I range her into external rotation of the femur. You can tell she's breathing a little heavy. That's kind of uncomfortable, so I'm going to back off a little bit because that's super uncomfortable. Are you feeling that in the knee, Ashley? No. Okay, good. So again, I'm going to constantly ask her if she's feeling it in that symptomatic spot. But just again, you can do all the treatment you want in the world to this knee. If you don't address the underlying cause, this thing's not going to get better. It's just going to keep getting irritated. You can bury that thing in ice till the cows come home. Not going to see much improvement. Okay, so what I want to do is kind of really open up this glute med, glute min. Okay. You know, that IT band will kind of, that fascia blends right into the glute max and right into these smaller glute muscles. So you really want to make sure that you spend some time in here. So for you, Ashley, definitely get a ball, okay? Start working on this tissue with the ball in addition to rolling out your quote-unquote IT band, but stick to like the hamstring aspect and the quad aspect. Don't get right on it, okay? So I'm going to work on this hip for her. Is that super tender? On a scale of 0 to 10, 10 being like the worst possible pain. 7.5. Listen, again, you know, this is sports massage, people. This isn't a feel-good massage. There's no candles in here, okay? There's no, you know, scented waters and stuff. This is intense stuff. But if you want to get better, you know, we definitely want to kind of get in here and do the work. A little close-up of like this hand positioning. So you're seeing, you know, I'm using my thumb for this. I don't really like using my thumbs a lot, but what I want to do is kind of get up into this upper glute area, and then I'm really ranging her into this external rotation, like I said. It definitely doesn't tickle for sure, but I can already feel this tissue starting to soften up, which is going to decompress that attachment point for me. You doing okay? It's getting a little better. It's a little more tolerable. Okay, great. All right, Ashley, I want you to lay on your side and face me now, okay? So I got her in a side lying position, okay? So I put her in side lying and her knee is now flexed, her hip is flexed and the knee is on the table. So now what I'm doing is I'm putting this tissue on a little bit of length, okay? So what I'm doing now, obviously I've still exposed a lot of her upper glute in this area. And what I want to do is kind of get right on that greater trochanter and kind of work, you know, up to her ilium from there, okay? So really, I'm kind of just spreading that force out and that tissue out. here's kind of like the meat and potatoes for this treatment right here. So what I want to do, like I said before, the whole goal for this treatment today is to kind of create some shear force on this IT band and kind of separate it from the underlying tissue. Especially when this starts to get irritated and inflamed, this bad boy just kind of locks down, okay? So I've got her back on her back, I've bolstered the bottom of her knee, and I'm gonna use as little lotion as possible for this so that I can create a little bit of friction myself, okay? So what I'm gonna do here, I'm gonna get on the opposite side, and I'm gonna use as many fingers as I can, and I'm gonna start kind of up proximal to her hip, and I'm just gonna kind of yank that IT band up towards me, okay? So the reason I'm using as many fingers as I can here is to spread my force out, okay? So I'm not pulling with one finger and like really digging into that IT band. If I spread my force out here, I can kind of create some shear force without like killing her, okay? How's that feel? It's not terrible, right? This is not the worst thing I've done to you today so far, okay? So what I'm doing is working this IT band a little bit at a time, okay? And kind of creating some shear. How's that feel, okay? She's gonna start to feel it more and more, and you'll be able to get a better grip as you kind of get closer to the knee itself. So I'm kind of posting her up here with my hand so that I can hold her knee down as I kind of use my right hand to, again, create some of that shear. So I'm using that lumbrical grip, kind of getting in there, again, as little lotion as you can get away with. You don't want to irritate the skin, but at the same time, you don't want to be kind of slipping and sliding off this thing either. There we go, getting right up in there. How's that feel? Kind of horrible? Not bad though.
Not bad.
So now I've worked kind of anatomically, I'm working superior towards me, but now what I'm going to do is work my way back, but I'm going to press down, okay? So I'm going to create shear force in the opposite direction. Up stop. Really quick, okay? So what I'm telling Ashley to do right now is, again, the classic kind of preseason mode, doing 2-3 days, 2 practices a day. For athletes, it can be really tough to spend that time working on your warm-up or your corrective. So, but for her, doing some glute activation, doing some oblique and core activation, that kind of work can really go a long way in preventing injuries like this. A lot of times what happens is just because of the mileage that she's getting in preseason, this glute gets all jacked up. It starts to fail to do its job to stabilize the hip and just goes into lockdown mode. This locks down and it sets off that whole kinetic chain down to the knee, and then this thing starts to get really irritated. Go into full knee flexion. Now I'm going to actually treat the pain site, okay? So I'm going to do this mostly with the Graston. So this is where we want to bring some blood flow to that fat pad on the lateral side of the knee. I'm also going to release the lateral retinacula and strum right over that Gertie's tubercle where that IT band is inserting on, okay? So the advantage to doing it this way is I'm actually going to create a little bit of blood flow, right? So if these tissues are having a hard time recovering, blood flow is the name of the game. It's one of the reasons I prefer more active recovery modalities, especially for, sports like soccer, repetitive stress sports. So I'm using this little GT3 instrument or this little smaller beveled instrument. I'm kind of going, against the grain. This IT band's attaching into here. I'm basically doing a little bit of light cross friction on there. Does that hurt? No? Okay, so I want to create some blood flow around that IT band. And I'll go back to this convex instrument, and then this will just help me kind of cover a little bit more ground around the outside part of her knee. So she's not really swollen, she's not really puffy in here, but she's definitely showing all the signs today of classic kind of IT band syndrome, which is like really painful to tenderness in the glute, painful with running. Like I said, grade 1 is probably what I would assess this as, just because she's not getting it constantly. It's really only when she runs at this point. So the good news is we caught it early, so hopefully it doesn't progress from here and we can kind of stave off any worsening of symptoms. Okay, so now I'm kind of working that lateral chain. So I'm really kind of keeping that that convex bevel right in that hamstring and IT band insertion. on that border. I'm not really going right on her IT band. I'm just behind it now, just in front of it. Okay, great, awesome. All right, so that's it for the treatment part. So what we're gonna do now is go back in the gym. I'm gonna have her retest this like we did before, see if that pain's come down at all, and even if it's not completely gone, which again, it's not gonna be completely gone, but if we go from a 7 to a 3 or 4, then that's showing us that our treatment is being effective, and we're just gonna continue down this path. So let's go to the Performance Center and let's test it out. Jog of that? That's good? Like how much better? 3 notches? There you go. Atta girl. So we're gonna just go on her way. Quick little rock tape application now for Ashley. Okay, so I've already gone ahead and prepped this tape. It's gonna be a 2-piece application. So what I'm gonna do is I put her kind of in this like horizontal like adduction position. She's gonna drop that hip down. So we're almost putting this tissue on a little bit of stretch. All right, I've already cleaned her off with some rubbing alcohol. And I'm gonna anchor this tape right on Gertie's tubercle in the front of her knee. And I'm going to actually give her a little bit of stretch just to give it some support. I'm going to run this right along that fat pad, right? Watch your angles here. And then straight up the back side of that IT band, okay? The reason I do that is I want to create some blood flow around this and create a little bit of shear using the tape. So it keeps that skin, that fascial layer moving over the IT band. So we're just going to rub that on. Now I'm going to bring her into full flexion. Okay, and we're going to do a decompression strip right over that lateral aspect where she's getting that irritation. So we're going to go exactly the opposite, right? So I'm going to split the tape in the middle. I'm going to take all the stretch out of it. I'm going to lay it right down on that knee in that spot. Okay, so we're going to anchor it right in her patella tendon and then right on her fibular head. Okay, rub that down real good. And there you go. That's a nice little application of rock tape for an IT band syndrome. So this is that Mark Pro setup that I was telling you about. So basically what I did here was I got her on her VMO and that common flexor bundle. I got one lead there, then I got one on her glute and her hamstring. We're just gonna let that bump out for about 20 minutes as a nice little feel-good finisher, just to create some blood flow and to continue to help her recover. Thank you for visiting me in the lab. You can see me on Instagram at MikeStella_ATC. You can visit AMP on Instagram at AMP_athlete, or check us out online at ampathletes.com/recovery lab. Thanks for watching.